Thank you for staying with us. From the Leeds, Grenville, and Lanark District Health Unit, I'm talking with the Public Health Nurse and Immunization Coordinator, happens to be Erin McLean, right?
Yes.
So, Erin, let's talk about the flu vaccine.
Okay, so as in previous years, the flu vaccine comes out every fall.
Right.
They do their best to match the variants to what they expect will be the circulating virus of the year. So every year there's a few different variants in the flu vaccine. It becomes available at the beginning of October, and we always start with the high-risk groups first.
Which are?
So we always go with the most vulnerable. So our seniors who are in residence in long-term care,
Yes.
retirement homes, other congregate living settings, and then others who are deemed to be in that higher risk of severe complications from flu. So it does include, there are some categories for children who might be immune compromised because of other health conditions. They might need an earlier flu shot than most kids.
Yes.
They're also from the Indigenous population and Métis. They tend to be at higher risk, as well as anyone who's homeless.
Okay. All right. So when will it be available?
It's available now, and I say that technically it's available now. It all depends on distribution.
Yes.
So the province gets it available, they start shipping it out. So we've just started receiving it at the health unit to start sending it out to the healthcare providers so they can give it to their clients who fit in those categories. So we're in the process of sending it out to long-term care homes and retirement homes now as well.
So this is the time to check with their healthcare practitioners and professionals to find out whether or not they have the vaccine serum.
Exactly. So they'll be receiving it over the following week or so. As we get it in, we send it out to them so then they can start scheduling clinics with their patients.
So there's not a health unit clinic being set up?
No, we don't have the capacity. Now that the COVID days are done, we don't have the staffing to provide COVID or flu clinics. So pharmacies are your other venue to go to. We strongly encourage you to go to pharmacies because they have longer hours, they're more accessible, more locations. Not all of them will have it for the high-risk population, though. It might take a little longer to get to your pharmacy.
Okay. Anything more you want to tell our viewers about the flu vaccine?
I strongly encourage you to get your flu vaccine. You might not be at risk of complications from the flu, but people around you may be. So people who may not be able to be immunized or are more vulnerable. So if you are around young children, you should get a flu shot. If you are helping to care for an elderly parent or other family member in long-term care, get a flu shot.
Yes. Yeah, don't be a carrier.
Exactly, yes. You might be fine, but others around you may not be.
Right. Let's talk about COVID vaccine.
So COVID vaccine, this year, it's on the same timelines as the flu vaccine. And same idea as the flu vaccine, it's trying to keep up with the new variants that are going about. So we often get asked, well, what variants is being covered this year by the COVID vaccine? So last year was XBB, this year it's KP2. So we have literally just received that vaccine as well and are sending it out to the same target groups. So we're sending out to long-term care, to retirement homes, and our healthcare providers.
Alrighty. So now, can people that want to have both COVID and the flu shot, can they get both at the same time?
Yes, they can. They can choose to have it in the same arm or one in each arm. There's no requirement to space them out.
And there's no serum out there that is actually combined at this time, is there?
Unfortunately, no. They are made very differently, so they have not found a way to put them all together in one needle. We would all love that too, but has not happened yet.
Not yet.
No.
So what are the vaccines that are available? Is Moderna, is there a Moderna?
So they have simplified things this year in terms of age groups and types of vaccines. So we generally talk about them as either an mRNA vaccine because it's made a certain way or the non-mRNA. So people are familiar with the terms of Pfizer and Moderna.
Yes.
They are both available, but the non-mRNA, the Novavax, it is not available.
Okay.
So you may have heard it was approved for use in Canada because all vaccines have to go through an approval process with Health Canada. Unfortunately, we're not allowed to administer it because it's not produced in Canada at this time. We're only allowed to administer vaccines that are actually manufactured in Canada because of agreements.
So if someone is thinking about going for a flu shot or a COVID, and they have a little sniffle or whatever, a bit of a cold, should they go and have it?
If it's just a sniffle, go ahead.
Okay.
If you have an active fever or active symptoms of coughing and you've got a lot of drainage coming out, wait till you're feeling a little bit better, then go get it.
Okay.
Now, if you know you've had COVID in the last few months, it's the same thing as getting another dose of the vaccine. You don't need a COVID vaccine.
All right.
So,
anything else that you would like our viewers to know, either about the flu or the COVID vaccine?
the season is approaching. Now, COVID's already been circulating. Flu, we are just starting to get reports of cases occurring, so it's not really active. It's a case of wanting to get the vaccine a little sooner rather than a little later. So call your pharmacist, call your healthcare provider, get an appointment booked, and go get vaccinated.
Thank you for coming in, sitting down with me, and talking about the vaccines.
Well, thank you.
Yeah.